All right, we should be good.
We're good. Okay, good afternoon and welcome to the Insurance and Pharmaceutical Subcommittee of the Health and Government Operations Committee. On this, the 1 week before the end of session, otherwise known as sine die. We have for us today two of which, and then a third bill. We are going to give folks opportunity to make comments, ask questions, and then we know that on two of the bills we are likely to be voting. One is going to be a discussion that will take us to the next step and determine how we can move forward on these issues. So with that, we are going to start with, we're going to actually start with Senate Bill 614. And I want to welcome Chairman Bidle's Chief of Staff here today, Nancy Crawford, who's observing our subcommittee. And Lisa, you want to tell us what Senate Bill 614 and House Bill 865 do?
So as introduced, these bills require carriers to provide coverage for orthosis and replacements for orthosis and expand the current mandated benefit for coverage of prosthetic devices to be coverage for prosthesis and replacement for prosthesis. And the bill also requires Medicaid to provide coverage. So with the amendments, the provisions of the bill that would have required coverage for orthosis are struck. The amendment limits the required coverage of prosthesis to once annually. It alters coverage requirements for replacements of prosthesis, and it specifies that covered benefits may not be subject to higher cost sharing requirements than those for other similar benefits. The amendments also specify the legislative intent for Medicaid coverage of certain codes for prosthetic procedures and devices and require an evaluation of the cost impact for requiring coverage of orthosis.
Thank you, Lisa. Ms. Crawford, would you like to say anything about the bill?
I don't really have anything to say about the bill. The fiscal note was really reduced by the amendments that we made. It's down to, I believe, $800,000 now.
To the state.
To the state, yes. And you know, we hope you all like what we did to it.
Thank you very much. I appreciate that. Is Delegate Martinez on? Bridget, is Delegate Martinez around?
Yes, he's here.
He's here. So Delegate Martinez, would you like to add anything about the bill?
I would like to thank first Senator Bidle, Nancy, and the entire team for their support and help getting this fiscal note down. I also want to thank Cheryl and Kyle, some advocates on the call from So Everybody Can Move Maryland. They really helped bring us the codes and information from other states so that we really could narrow down from that $15 million fiscal note that we originally had for FY25. Now we're down to 800,000, and that's definitely the work of the collective. And I just want to thank everyone for getting us to this point, and really hope that we can get it out of subcommittee today.
Okay, great. Thank you, Delegate. Delegate Taveras, you have a question or a comment?
No, thank you. No, this looks great. So now I just have a question, just basic about, like, for me, like what does it get that, what do the changes do ultimately in terms of how it impacts clients who need different prostheses in order for them to continue doing their daily activities? So how does ultimately this bill impact that?
Okay. Ms. Sachs, did you want to respond to that, or
yes,
shall I ask counsel?
Yeah.
Okay.
I'd be happy to respond to that. Delegate Taveras, thank you for the question. So essentially with the amendments made to the bill, what it ensures is that any individual who already has an everyday prosthesis, with the language in place in the bill, should their care provider deem it medically necessary for them to receive a secondary device, they would have access to that device through their insurance with the legislation in place. The amendments, again, as Lisa alluded to, thank you. Probably the biggest change to this legislation is we are removing all orthosis language from the legislation until a cost study can be done to look at what the impact is going to be in providing coverage for orthotic devices. Orthotic devices are the external braces. The prosthetic devices are the artificial arms and legs. So with the amendments in place, individuals who wear prosthetic legs or prosthetic arms would have access to the activity-specific devices with the devices in place. And then just to kind of build on that, and what Delegate Martinez said, the amendments that are in the Senate bill were worked upon and agreed upon with many individuals who are on this call. Tricia and Allison, thank you. We work with the commercial carriers. Deputy Secretary Moran, I think I saw you on the call. So thank you again for taking the time to learn more about this legislation and the codes to help us to address some of the concerns in the initial bill language.
Great. Thank you very much, Ms. Sachs. I appreciate it. Delegate Kaiser.
Excuse me. Two questions. My first is for Ms. Sachs, who just spoke when she referenced that study language on the orthotics. Is that study language part of this bill? So that's just my quick yes or no. I'm saying the nodding head. My next question is for Mr. Stepp. I would like to know how satisfied he is with these changes, given what we were looking to do from the beginning. Is this doing 10% of what you wanted to do? 30% of what you wanted to do? I'd love to get some honest sense of that.
Yeah, so I think this team has achieved everything they could, possibly, especially providing the prosthetics for individuals that need physical activity for both commercial payers and also our population that uses Medicaid. I think in the future, there's a population that should have that access to physical activity, being those that use orthotics. But I think we're doing the right move to make sure that we're studying the information because we don't have that data completely, but we do have the data that provides us the insight for those that have limb loss that need prosthetics for physical activity.
Okay,
Since you weren't willing to give me a number, Madam Chair, I guess I would just further ask the question. As I was understanding from the bill hearing, allowing for someone to do alternate activities and then to have the appropriate prosthetics for those activities. Are they going to get it through this?
Yes.
Okay. All right. Thank you.
Delegate Johnson.
Thank you, Madam Chair. And I am sorry, but this is not a question. I just want to thank everybody who worked on this bill. It's not my bill, but I really, really like this bill. I think it's really important for the citizens of Maryland who have had something drastic go wrong in their life or have had some hardships or for whatever reason has lost a limb, to give them as normal a life as possible and let them participate in activities like the rest of Marylanders. So I do appreciate the work and the continued work on this bill that you all have done. So thank you.
Thank you, Delegate. So seeing no additional raised hands, I would like to
move the amendments.
Let's do SB 614 first, in which case I don't think there are any amendments on that. Am I right, Lisa? So that one came to
favorable.
us.
Right, that's
Okay,
favorable.
Second.
We have a favorable, we have a second. All those in favor, please say aye.
Aye.
Will there be any opposition? Okay, seeing none, the bill passes unanimously. Now we're going to go to House Bill 865, the same bill, only we do need to amend this bill to conform.
Move the amendments.
Second.
Motion on the amendment and a second. Ms. Sachs, you have additional information?
Yes, so I was just, thank you, Madam Chair. As I was reviewing the House bill amendments, on the first page, line 3, orthoses was inadvertently not removed from the title of the bill.
Lisa, we can do that?
Yes. Yes.
Okay, so we will amend the amendments to make sure that orthesis is removed. Thank you,
Madam Chair.
Thank you for catching it. Any further discussion on the amendments? Seeing none, those in favor of the amendments, please say aye.
Aye. Aye.
Any opposition to the amendments to House Bill 865? Seeing none, can I have a motion on the bill as amended?
Move the bills amended.
Second.
It's been moved and seconded. Any discussion on the bill? Seeing no hands, those in favor of the bill, please say aye.
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 Any opposition to the bill as amended? Seeing none, the bill passes favorable with amendments. Thank you all very much for your work on this bill and getting us to a place where, as I think Delegate Johnson said eloquently, will help a lot of Marylanders. Okay, we are going to move to House Bill 1376. That's Maryland Medical Assistance Program, Maryland Children's Health Program, and Health Insurance Special Pediatric Hospitals. This is a Delegate Rosenberg's bill, and I would like to go to Lisa. Tell us about the bill.
This bill requires carriers to provide coverage for a special administrative day at a special pediatric hospital if the patient is eligible for discharge, but there is no safe environment for transfer. A carrier must reimburse for a special administrative day on the same basis and at the same rate as the reimbursement provided for a combination of an administrative day and ancillary services provided by a special pediatric hospital. Beginning July 1st, 2025, Medicaid must provide the same coverage under the bill as carriers.
Okay, thank you, Lisa. Delegate Rosenberg, would you like to speak to the bill?
I can speak briefly to what prompted me to introduce the bill, because the experts are here from both Hopkins and UMS, which own Mount Washington Pediatric Hospital, which is an intensive care, well, intensive not in the sense, it's a step down from intensive care, I guess, but is in my district. I took a tour and they raised the issue that the bill seeks to address in terms of compensation and insurance coverage for the care that is provided at Mount Washington Pediatric Hospital. And the bill seeks to address those deficiencies. And one of the questions before us is, to what extent can this be done by legislation, or to what extent can it be done administratively? And your call, Madam Chair, obviously, if you want to hear from either the Hopkins or the UMS folks now, or how you want to handle things. But that's why I introduced the bill, to address the problem.
Thank you, Delegate. That's really helpful. For those who are not necessarily involved and maybe watching this subcommittee, Mount Washington provides services to children who have had traumatic life instances or health issues, have been treated in acute hospital, and then, as Delegate Rosenberg said, gone into a still fairly intensive medical environment, but not the kind of level of care that hospital provides. But the issue then becomes they often have continuing needs and need greater support sometimes than they can get in their home environment. And the question is, they sometimes have to stay at the Mount Washington facility beyond what would be qualified as medically necessary, and that there is cost associated with those long-term stays or longer-term stays, and the Mount Washington is attempting to sustain itself by making sure that it has adequate reimbursement for those days. So that's the issue. And what I'm planning on doing after I call on Delegate Kaiser is I've identified 3 sort of outstanding issues. I'd like to talk about each one and get the perspective of both sides. And then at the end of that, the discussion of each of them, we will, or of all 3 of them rather, we'll decide what next steps will be. So Delegate Kaiser.
Thank you, Madam Chair. As you know, I've sat in some meetings about this, but I'm curious if maybe Lisa can explain, and maybe for the other members on the subcommittee, just so everyone understands what administrative day and ancillary services even covers. I think that might help the subcommittee's understanding of the bill.
Thank you, Delegate. That's helpful. Lisa, I don't know, Lisa, if you want to do that, or I can ask for someone from Mr. Huber or Ms. Bryce to to tell us?
I can read the definitions, but for something more specific, you might want to ask. It's up to you.
Okay, I'm going to go then to Mr. Huber or Ms. Bryce. Which one of you would like to describe the difference between administrative days and what was the second thing, Delegate Kaiser?
Ancillary services.
Services. Got it. Okay, thank you. Who'd like to answer that question? Oh, I'm going to go to Ms. Miller,
Okay.
who's got her hand up.
Yeah,
Okay.
I'm sorry. I mean, I'm happy to answer that. I'm from Mount Washington Pediatric Hospital, and just for the sake of definition, an administrative day is what we refer to when a patient no longer meets criteria for medical necessity for the level of care, but they're still here. An ancillary service are all different kind of services that we provide to those patients. It can be physical therapy, it can be respiratory therapy, it can be labs, radiology. So it's all of the medical services that we provide, not including sort of the basic charge for room and board. Does that help?
I believe so. Yes, and Delegate Kaiser's giving me the thumbs up. Okay, so Ms. Roddy, you'd like to add to those definitions? You're on mute.
Sorry, one of the issues with how the bill is written, the way the administrative day rate is defined in the legislation, it does include room and board. So that's why we have such a large fiscal note on the bill. So I just wanted to clarify that issue so that we didn't think that as written that the department wouldn't have issues with the bill.
Okay, thank you. That's helpful as well. Okay, any other initial questions before I go through the three issues that I've sort of identified? Others may have questions as well. Ms. Bryce.
So I don't know if this helps, Delegate Cullison, and even Madam Chair, as you're saying that you may be about to launch into what I was going to offer up, which is just the sort of three reasons that the bill was filed to begin with, the three issues we are trying to address on behalf of Mount Washington, which likely align with your questions. I just don't want to jump in if that's unhelpful right now.
Well, how about we go through the three issues I've identified, and if they're related to yours, great. And if not, you'll tell me after we're done. Is that right?
Thank you.
Is that okay?
Absolutely.
Okay, thank you. So the first is currently there is a prior authorization required before a transfer from an acute care hospital to a pediatric specialty hospital. From the discussion that we had after the bill hearing, we understand that 3 of the 9 MCOs do not have that requirement for prior authorization. We're wondering if the other 6 can also suspend that requirement. And I am going to look to Mr. Wynn.
Delegate Colson, good afternoon. We are continuing to work on that, and we're going to meet this week, in fact, to talk about the next steps in terms of how the other MCOs can engage with Mount Washington to try to reach a voluntary approach to prior auth and transfers, or some mechanism, whether it's retroactive. It's important to keep some utilization management, the utilization review component in the managed care program. It's a public program, but we're partnering with them and we're trying to resolve it. And we're close to 50% of the overall membership, or at least the discharges being covered by the voluntary agreements by the MCOs that have done it. Others are still considering it. I mentioned it in the full briefing, and I mentioned it in the smaller work group we had shortly after, and I'm committed to doing it, and we will continue to work together to try to find a solution.
Oh, thank you. Thank you very much, Mr. Wynn. We appreciate that. Questions, thoughts, responses to Mr. Wynn's comments? Mr. Moran.
Yeah, I don't necessarily have any thoughts on Mr. Wynn's comments, but Vice Chair, if you want to move through the rest of the list, I did want to take the opportunity to sort of talk about the department's partnership and weekly conversations with Mount Washington Pediatrics on the host of issues, but I'll defer until you're through the list.
Oh, okay, great, thanks. Any other thoughts? So it sounds on the first issue, we've got some work that is continuing and discussions, really current and contemporary discussions. This isn't being put off. They're actually meeting this week. Is that right, Joe? Yes, okay. Okay, so a second one is, I guess from my perspective, it's finding the right amount of funding necessary to maintain and sustain the work of Mount Washington when it's providing services to children for whom there is no place to go, and who may be staying there in a longer term. So I think, it's really, if some folks want to talk about what the current rate is, and what the necessary rate would be, open to hands raised. I think Delegate Taveras, did you have your hand? Yes, you did. I see it now.
I just need clarification. Do you mean no other place to go because they have no other housing, or because they have no other medical provider that can provide the type of service that is provided at Mount Washington?
It's a little of both, I believe, and I believe that Ms. Miller will probably correct me if I'm wrong. But if they couldn't go into their own home with the services they needed, that would be one of the reasons why they were staying there longer, perhaps. And again, I'll be corrected if not. But another reason is they need more services than can be provided in a home setting, and therefore there's no facility where those needs can be met. So Ms. Miller, I'm going to look to you to help us understand.
Thank you. Yes, it's a variety of circumstances. These children, even though they may be stable enough to leave inpatient care, are still medically fragile. Sometimes they're on a ventilator, sometimes they have an open wound. They still have many needs. And in some cases, we're able to train the caregivers in the home so they can get there, but sometimes there's delays based on the family needs. And sometimes there needs to be some placement other than the home, and we work with DSS and other community supports, but we do need to make sure it is a safe discharge before we feel comfortable letting them go.
Okay. So, so that answers that question, but can you address, or can someone address the funding that's currently available for those youngsters who are maintained there in this setting when no longer being medically necessarily required? Is that you, Ms. Miller?
Yes, in fact, I can jump in, and I'm sure others can add. So I do want to thank Trisha Roddy and the representatives from the state. We have been working together, as Mr. Moran indicated, on these issues. And we did make some real progress on this one. There was a transmittal that went out last week that clarified that if the fee-for-service Medicaid determines that the inpatient care is no longer needed, the patient and the inpatient stay remain the responsibility of the MCO. So that even if there's no longer medical necessity, the MCO would then be required to pay for the continuing ancillary services that we're providing while we're arranging for a safe discharge. So that was very helpful, and we do appreciate the state's work on that. The other piece is if the child is covered by fee-for-service Medicaid, they're not in an MCO. And again, we've been working with Trisha Roddy. There are, and maybe I'll let her explain this, but there's some new state regulations that will apply to us. The remaining outstanding question is at what rate we would be paid for those days. And maybe the state can fill us in on where we are with that. But we do appreciate the progress that has been made so far.
Thank you. Thank you very much. I'm going to ask, so just for clarity now, is the MCO paying for the cost of the stay at the same level they were paying when there was medical necessity? Or is there a reduced amount from the MCO for those youngsters who are still there after medical necessity?
It's a reduced amount because it would not include the room and board charge.
It doesn't. So where's the room and board funding coming from?
So I probably should step in. So, so this goes back to the issue. We don't, for all hospitals. So we you know, what we're talking about here, is not specific to just Mount Washington Pediatrics. It's across all acute hospitals and other special pediatric hospitals. So, and these types of children that we talked about today, as I explained in the hearing, are not unique to just Mount Washington Pediatrics. So we don't pay for any room and board charges on denied days. Our MCOs have been required to pay for medically necessary ancillary services on denied days. That's been in effect for a number of years. And we are working on a policy to cover medically necessary ancillary services on the fee-for-service side. So again, the policy, we're trying to mirror the policy for with our MCOs, and we're addressing both acute and special pediatric hospitals. Now, Mary has shared some data with us, some Excel spreadsheets. We are, and we've talked with Mary about, yes, we are just, we have nothing to verify the data that's being provided to us. It's just, an Excel spreadsheet. We are willing to take that a little bit on faith. On the fee-for-service side, we have to, figure out if there'll be a two-tiered rate, but potentially what will probably happen is that after we implement this rate, we will go back, and once Mount Washington Pediatrics starts billing it, to see if in fact those are the right amounts that we're paying for. So again, there's a little bit of faith that the department is going to be taking with Mount Washington Pediatrics in terms of the data that they provided. But we will go back probably once billing occurs to see if in fact that was the right rate.
Thank you. That's very helpful. Thanks. I'm going to, Delegate Taveras, you had a question? The hand's still up. Okay. I'm going to go to Ms. Logren. So if you can help us see from your perspective as working with an MCO.
Yes, thank you, Madam Chair. Good afternoon to all. I don't disagree with what's been said, but I do want to close the loop on the funding that you asked about, Delegate Colson. Another component to this is that the MCOs have been and remain required to pay for those medically necessary ancillary services throughout the stay. And apparently those services have not been billed for in the past by Mount Washington Pediatric Hospital. So I think it's important to keep in mind those are dollars that should have been paid, and I assume will start to be paid going forward as a result of Mount Washington submitting claims that they were not submitting for. So you're going to see those dollars flowing into the hospital as well.
Okay, great. Thanks. Delegate Kaiser.
Thank you, Madam Chair. And maybe Ms. Miller can address this as she also responds to the last comments. But I'm just trying to understand who has been paying for these kids when they've had the extended stay and they no longer meet medical necessity, and yet they can't go home for reasons that sound pretty medical necessary to someone like myself. So could someone explain who has been paying?
Ms. Miller, you want to take a stab at that?
Yes, on a couple of things. First of all, one of the reasons the transmittal that came out last week from the state was so helpful was that it clarified the MCO's responsibility, because in the past, when we reached out to the MCOs for continuing coverage, we were told they were no longer responsible. So that's why this transmittal was so helpful. It's not that we didn't try to get reimbursed. Now, what's been happening with these children, It's a variety of different things. Occasionally, DSS has custody and they will reimburse us, but that often it isn't the case or isn't the case for much of the overstay. The other thing that changed is the availability of nursing in the community. You know, pre-COVID, it was just easier to get these kids home because there was more community and home nursing available. So this really, you know, the world changed and we had one baby that was here for 3 additional months because we couldn't arrange home nursing. And that's when we realized we needed to go to the state for some help with these the potential of these large overstays. Does that help?
Yes, and the shortage continues, am I correct?
Yes, it's not as bad as at the height of COVID, but the shortage absolutely continues.
Okay.
Madam Chair, if I could follow up, part of what I heard Ms. Miller say was that a baby could be in the hospital for 3 extra months because there's not some nurse or service for their home. And I guess I just want to remind everyone as we think about this bill, this fiscal note, and all these intricate financial details that related to this, that ultimately we're talking in a lot of cases about not just who's paying, but why are kids staying in the hospital that long when they needn't be, and all the reasons that we know that a kid should be in a home setting and hugged and all the things that are happening there. So I just wanted to express that this problem goes beyond the legislative piece we're talking about today.
Thank you. Any other thoughts about, so heard a couple of things. It has been some progress, at least with respect to the role of MCOs and continuing to pay for the ancillary services. Sounds like MDH is working on how to make those similar arrangements in the fee-for-service program. I'm still and not limited to the pediatric care that Mount Washington's providing, but to other settings. I'm still a little worried about the room and board costs. As long as we don't have, available appropriate settings to meet the needs of the kids outside. So that will be something that clearly we need to work on. Anybody else have thoughts on that funding piece? Ms. Roddy.
I mean, that's largely what's driving our large fiscal note, right? It's the room and board piece, the 36 million. And, I think when we get into this too, we get into, how nonprofit hospitals, their charity care and their uncompensated care, there's a requirement for a certain level of charity care that they have to pay for their nonprofit status. So it gets a little bit more complicated as we get into some of those definitions.
Yeah, no, I think that's really helpful. Thank you. Okay. Ms. Miller.
So the charity care is a great point. And just to clarify, if the care is deemed medically not necessary by a payer, we can't call that charity care. We can't count that. So we had brought that up to the state just as a side issue. I just think it's worth exploring if there's ever the opportunity to do that.
Well, I think I can guarantee there's going to be the opportunity between now and next January to discuss that. So we can continue to work on that.
Thank you.
Any other thoughts? Tricia, your hand's still up. Did you want to follow up? Okay. Okay, so that's the second issue that I had identified. And then we were told that there are concerns around the right to appeal the Medicaid determination regarding medical necessity. And so I guess I'm going to go to either someone from either UMS or Mount Washington or Johns Hopkins to talk about what some of the issues around the appeals have been.
So I'm happy to take a stab. Oh, sorry, Michael, do you want to do it?
No, go ahead, Kristen.
So I'm happy to take a stab at that one. So the request in the legislation is that Mount Washington have an appeal right as the facility when there are medical necessity determinations that go against them. So the department decides that the patient has no medical necessity remaining. Mount Washington would like to be able to appeal that decision. All of our acute hospitals have the right to do that. What seems to happen in Mount Washington's case, though, is that there are sort of varying degrees of uncertainty about whether they have standing to appeal on behalf of that patient or not. And so many of the cases have gone against them literally on a technicality. You don't have standing, we're not going to hear this appeal. I do want to clarify, as I'm looking at my MCO friends, we do have appeal rights through the MCOs, and that seems to be settled. This is an issue within Medicaid fee-for-service. So again, the bill just trying to clarify that Mount Washington, like all acute hospitals, has an appeal right on behalf of the patient for med necessity determinations. And so I know our lawyers have looked at this, and they kind of shared their challenges with us as the bill is being drafted. And I don't want to speak for the department, but I know that they have also had their own lawyers, their own counsel looking at this issue in an effort to resolve it. So they may want to comment on where that is heading now.
I'm happy.
I heard it. I'm happy to
step in.
There we go.
So we're moving. So you don't need a statute change in order for us to accomplish this. And I'll do it in sort of my layman's terms as I understand appeal rights. So essentially, I think what Mount Washington Pediatrics is asking is that they have the same appeal rights that acute care hospital has, where there's a retrospective review regardless of where the child is. So I guess right now, apparently when these, there's cases, if the child is already at home, the judges, ALJ judges are saying, well, it's moot because the child is at home and they're not in your facility. So our attorneys are going to clarify through a transmittal that Mount Washington Pediatrics will have retrospective appeal rights. Again, that does open up the entire stay for review, and the acute care hospitals are used to that. This will be new for Mount Washington, and we've agreed that we could, when our attorneys are finalizing the provider transmittal, we would share it with Mount Washington in draft form so that they could understand it and ask questions. But we're committed to moving that forward. Our AGs say that we can do it through a transmittal. We'll probably eventually want to clean it up in regs as well.
That's good news. Thank you. Any thoughts, responses to that? Okay. All right, seeing none. I'm going to go back to you, Kristen. Did we get to some of the concerns that you came prepared to discuss?
Thank you, Madam Chair. So I do appreciate the discussion, and it sounds like we have gotten clarification on the three issues. I mean, I will say, look, on prior authorizations, I want to give the MCOs credit because twice during COVID, right, they voluntarily waived prior authorization requirements for these kids. It helped a lot tremendously with throughput in our acute general hospital, where those pediatric beds are really valuable. And it helps these kids get to an appropriate setting as quickly as can happen, right, when they need rehabilitative care. So we appreciate that. And I do want to note for the committee, during those two time periods with 100% voluntary waiver of prior auth, there wasn't one admission decision that was overturned. So I do think that is a process that could work well without a prior authorization process. And we are just, we are still hopeful that the MCOs will look at that issue more closely and make a decision again to voluntarily waive. On the appeal right, really appreciate what we just heard from Tricia. Again, she has leaned into this. we were going to get our lawyers together. I don't know if that's necessary at this point, but it sounds like we're moving forward on the appeal right. And the third issue around these reimbursements for overstay, both in the MCO world and in the fee-for-service world, between the transmittal and the new regs that are being issued, I think that we do have the framework for a solution here. And so I don't want to speak for all of my colleagues. I know Mary and Jen are on for Mount Washington, and obviously Michael for Hopkins. So if I misstated any of that, I'm happy to be corrected.
Ms. Biller?
No, I just want to echo it. Thank the committee, thank Trisha. You know, we've made some good progress. I think this will benefit the kids and the communities that we're trying to help, and you know, look forward to continuing to work together to advance this.
Anyone else want to make any sort of summary remarks or thoughts?
Vice Chair, this is Ryan Moran, if I can. I just also just closing out from the department's perspective, in addition to what Kristen and Mary said, I want to thank Delegate Rosenberg for bringing this piece of legislation forward. And I just want to reiterate the department's commitment to work through these issues, obviously in a short period of time that has included weekly meetings with Mount Washington, Michael, Kristen, Mary, and others. We've moved forward with what will be 2 transmittals that will be out on the street and updated regulations, and obviously some positive and good candid conversations with our managed care organizations. I also, you know, you don't get the opportunity to thank your team, but I want to thank Trisha Roddy, who's just done a remarkable job in stewarding this partnership and collaborative effort with the stakeholders in the department. And rest assured that over the interim that the department is tuned into these particular issues and will continue to make progress. And we look forward to providing you updates in the interim as we move forward.
Thank you very much, Mr. Moran. I really appreciate that. And I too want to add my thanks to Delegate Rosenberg for bringing this to our attention and giving us a chance to work on it, and the fact that you know, there's already been terrific progress, which means folks from the department as well as the advocates from Mount Washington are willing to and committed to really helping these children transition and, you know, be in a place where they can begin to thrive in a different way, so, or in a better way. So I'm going to let Delegate Rosenberg close us out, but before he does, I think the path we will take is to continue to work on this over the intersession, and if we need statutory changes, we'll identify them before the next session. So I think that's where we will go from here, pending the chair's approval. So Delegate Rosenberg.
Well, thank you, Madam Chair. There's no need to what we do in the budget in my not so recent past, you know, to impose any deadlines or anything of that nature, because we've made significant progress. This meeting has assisted in that process. And so I think there will be continued discussions. And as you pointed out, if there is a need for legislation, you want to know that before we come back next January. All, of course, pending upon the approval of the full committee chair. So I want to thank those of you who did the work. And that's pretty much everybody on the call, the non-members, and look forward to a successful result for the children and the hospitals, and for the system, the state system, by this time, or hopefully before, if there's no need for legislation. So thank you all, and especially the chair.
Thank you, Delegate Rosenberg. Really appreciate it. And with that, that completes the business before us today. I cannot promise you that we will not have another subcommittee meeting before next Monday. So, you know, please stay tuned. I think there are a couple of bills that are being worked on. We're going to see if they come to consensus before Wednesday. If not, we'll probably be seeing them next January. So With that, this meeting is adjourned. Thank you all very much for your time and commitment to this work today.
Thank you.